Hello, everyone. My name is Margarita Chavez Sanchez, and I'm the director of the Bernalillo County Department of Behavioral Health Services. Today, I'm here with Assistant Director, Dr. Marcia Harris, and we're going to talk about the Bernalillo Care Campus Crisis Stabilization Unit. Hi, Marcia. Thanks for being with us today.
Good morning. Hello, everyone.
So we're really excited about the fact that Bernalillo County is able to provide a crisis stabilization unit, but we want to make sure the community knows what that means. Can you tell us what a crisis stabilization unit is?
Sure. As the name implies, crisis, generally we provide care to people who are experiencing some sort of mental health crisis. And they don't need or meet the criteria for hospitalization, but they also need more time and support in order to work through whatever the crisis might be.
And I hear that the Crisis Stabilization Center is licensed as a crisis triage center. What does that mean?
Well, it means we have the ability both to assess a person's status, but also the stabilization part is we have up to a 14-day stay to help people sort of formulate plans for next steps in terms of what may be creating some of the problems they're experiencing, what sort of supports they might need as they go back to the community. So we have a 14-day stay to accomplish that.
Great. And when someone wants to come to the Crisis Stabilization Unit, how do they do that? How can someone access the support?
Right now, it all works through a behavioral health provider. So if the person might have been seen in psychiatric emergency room, the referral can come from there. If they have a program that they've been involved with, the program can refer. And if they're seeing a provider in the community now, that provider can also refer. And we try to make it a pretty simple process. So we have a dedicated referral number that people can call their provider would call us, and we would do an assessment to make sure we're the right place for them.
Great. So what I'm hearing you say is this is a provider-to-provider referral in order to intake into the program. Is that correct?
Yeah, that's right.
Great. So step one, the provider would pick up the phone, call that crisis referral line. They would either speak with you or one of the clinicians at the care campus. An assessment would happen at that point. And you would discuss kind of that transition and referral of the client into the program.
That's correct. That would be the process. We just have some questions we need to get basic information about, and then we basically arrange transport for the person. They can come on their own, someone can bring them, or we can actually pick up people if necessary, not from private homes, but from other locations.
Great. And when, let's say someone is, let's just say I'm a provider, I called, you pick up the phone and we chat and you accept a client to come in, what does that client need to have with them?
Actually, they need to bring some clothing. For the first 48 hours, we have folks just dressed out, but then after that, they can change into their own clothing. So bring enough clothing. We have washer and dryer. So even for the 14-day stay, they don't have to bring a lot. They can do their laundry, so they don't need to pack a lot. And sometimes people prefer their own hygiene items. We provide basic hygiene items, but they can bring some of their own. And that would be basically what people would need to bring.
Great. Do they need to bring their own medications or cigarettes or anything like that?
Good point. Yes, if the person is a smoker and wants to smoke, they need to bring their own cigarettes in an unopened pack, and only cigarettes. We don't allow vaping, roll your own, those kinds of things, just your own cigarettes. Medications, definitely people need to bring both any medications they have for medical conditions and any medications they might be on for their mental health needs. They're treated as home medications, and we assist people in taking their medications while they're with us.
Great. What if I want to bring a big bag of Doritos with me if I'm a client?
Please don't.
Okay.
We do ask people to stick with our food and our snacks while they're with us. So unfortunately, no snack food.
Okay, sounds good. I guess I'll leave my Doritos at home.
Yes.
So now the client has come in, you did an official intake. What happens over the course of that 14 days? Who do I meet with? What kind of treatment is the client engaging in?
So everybody meets with one of our counselors and they develop their service plan. So based on the initial interview, they've identified what they see as their needs. They have identified those with the clinician, and they develop a plan for all the things they want to accomplish within that next 14 days. They also will meet with a case manager who can work with them intensively on next steps. Many people that we see have insecure or no housing, so often that is a priority. We see people with co-occurring disorders, mental health and substance abuse, so they may be looking for a longer-term program that helps them address both issues. So our case managers work with them. Some of our clients have sort of transition coordinators through their insurance, so we all work together to try and find sort of the best support for after the unit, whatever that may be. And it's been widely varied what that looks like for each person. And again, the case managers work pretty intensively. While they're on the unit, we have a variety of sort of group process that we work through, mindfulness skills, distress tolerance skills, which really help people sort of get back to their higher level of function. So we have those going on. We also have a meditation group. Right now it's virtual because of the pandemic, but a lot of the clients really respond positively and say it really helps them sort of again regroup and start to feel better. Also, we have a journaling group that works and people enjoy that, as well as art experiences. So we try to hit both verbal and nonverbal approaches to coping skills, tolerating distress, and planning for your future.
Great. And what if I want, my family wants to come visit me while I'm on the unit?
We are pretty much a closed campus, but we can arrange virtual meetings or even meetings in person. That really happens through the work with the clinician. But in the 14 days, people often are maintaining contact with their family through telephone or virtual meetings primarily.
Great. Now, I think COVID has made things a little bit unique for us. You mentioned some of the programs have gone virtual. Do the clients need to have a negative COVID test to come to the unit?
People who are coming to us from other agencies frequently have been tested, and we do ask for the test results. We also have our own screening based on sort of the physical symptoms or whether there's been any chance that the person has been exposed.
Great. And what precautions are taken on the unit to make sure that, we have kind of that infection control and no spread of any germs, COVID or the other, any kind? What kind of precautions are being taken on the unit to make sure everyone's safe?
So one of the things we're doing is we have more than one program on the campus, but we're keeping them all physically separate so that there's no chance of cross-infection across the units. We have always worked hard in terms of cleaning and sanitizing, and our attention stays with that. We currently still require all our clients and all our staff to wear masks. And we also ask everyone to be very aware of the 6 feet social distance. So it even extends to, say, at mealtime when the census is higher, we may have our clients eating in 2 separate rooms so they can maintain the distance.
Great. Sounds great. Well, I think it's exciting to know. I think for some time it was a very focused referral, maybe from UNM or other hospitals, but I'm hearing you say that referral process is opening to any behavioral health provider, a provider-to-provider referral. Is that correct?
That's correct. In our first year, we really wanted to make sure that we had our resources in place and that we really understood what's the specific group of people we would be helping here. With a year's experience, we feel confident now in extending out to a variety of behavioral health providers who may refer to us.
That's great. And do you think that will increase significantly clients that access the unit?
I do. I think getting the word out is very important. Not everyone knows about us. And so I think as that becomes more apparent to providers in the community that there's this kind of resource for their clients, I expect it will grow.
Great. Is there a waiting list?
There is not a waiting list. We do run into a situation sometimes where we may have a male bed available, but not a female bed, but our turnover is fairly rapid. It is an entirely voluntary program. The maximum number of days is 14, but there are some people for whom placement happens at 5 days. So we will keep names and work back and forth with providers, but there's not a formal wait list. As a crisis unit, we try to really move as quickly as is possible and while still being safe.
Great. Great. Well, this is really exciting. I'm hoping we can all share this message in our networks and make sure that all the behavioral health providers in the community are aware of this resource. Dr. Harris, thank you so much for this information. Hopefully your phone starts ringing off the hook with referrals, and anything else that maybe I haven't asked you, that you think is important for us to include.
No, I think you've covered it very well. Thanks everybody for your time.
Great. Sounds good. Thank you, everyone. Have a great day.
Bye, everybody.